Theo, hello, and welcome to Hopkins at Home. Thank you for joining us. My name is Victoria O'Keefe, and I'm a member of the Cherokee and Seminole Nations of Oklahoma. I'm the Maturam Santoshem Endowed Chair in Native American Health at Johns Hopkins University, and I'm joined today by my colleague, Dr. Emily Haroz. I'll let Emily introduce herself.
Hello, everyone, and thanks so much for joining us today. I'm an associate scientist at the Johns Hopkins Center for American Indian Health and have been working with Victoria for the past 5 years, and we're excited to have you all here today.
Thanks, Emily. We're grateful for the invitation to share about a project that is really near and dear to our hearts with you all. It's a storybook titled Our Smallest Warriors, Our Strongest Medicine, Overcoming COVID-19. And today we'll talk about this project as well as the innovation and importance of Indigenous public health and storytelling. We want to start by providing an Indigenous land acknowledgement. It's really important that we all remember we're all on Indigenous land. So as we gather today together virtually from across the country, we acknowledge the Indigenous peoples of our homelands. We are all on Native land. We humbly acknowledge that Johns Hopkins University is located on the traditional and contemporary homelands of Indigenous peoples. Our campus resides on unceded lands of the Piscataway and Susquehannock peoples. We recognize the enduring presence of more than 7,000 Indigenous peoples in Baltimore City, including Piscataway, Lumbee, and Eastern Band of Cherokee community members. Together, we acknowledge the history of genocide and ongoing systemic inequities while respecting treaties made on this territory as a step towards reconciliation and strengthening relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty and right to self-determination. We aim to hold ourselves and the university community accountable to tribal nations. We also want to start by providing some information about the Johns Hopkins Center for American Indian Health, where Emily and I both work. Our center was founded in 1991 by Dr. Matu Santoshem based on more than 10 years of work with Southwest tribes that he had been doing. Our mission is to work in partnership with American Indian and Alaska Native communities to raise Native health status, self-sufficiency, and health leadership of Native peoples to the highest possible level. From this map, you can see our current scope of our work and where we're located. In all of the turquoise color, you can see these are all the states where we currently have partnerships with tribes and urban Native communities. And the red maroon boxes are where all of our center's offices are located. So you can see we're not located just in Baltimore, we're also located in Minnesota, Montana, as well as Arizona and New Mexico, all on tribal lands. And our center's work now serves more than 140 tribal communities across 21 states. Our center has a number of core areas. Dr. Santoshem's work was started with infectious disease prevention. So that's really where our center's work was founded. However, over time, tribal communities and urban Native communities began to talk about priorities that they had and issues that they wanted to address. This included issues related to mental health promotion, behavioral health promotion, and a really important part of our Center for American Indian Health is training the next generation of Indigenous public health scholars and leaders. I also want to provide some context about who American Indians and Alaska Natives are today. There are approximately 6.7 million American Indians and Alaska Natives in the US, according to census data. That's about 2% of the US population. And there are 574 federally recognized tribal nations. Approximately 1.5 million American Indians and Alaska Natives live on rural reservations, and there's 334 reservations. However, many people don't know that approximately 78% of Native peoples actually live outside of reservations, trust, and tribal lands and live in urban areas. And there are hundreds of diverse languages, cultures, and lands, and it's really important to remember that when we're talking about different tribes and different communities. Indigenous peoples, the first peoples of the lands now known as the United States, continue to demonstrate immense strength and leadership despite hundreds of years of attempted genocide, land theft, and ongoing colonization and oppression. Health and mental health inequities among Native communities today results from the legacy of colonization and continued structural and interpersonal racism. The federal government has a trust and treaty responsibility to provide healthcare and other services to American Indians and Alaska Natives, dating back to the signing of hundreds of treaties with tribal nations. However, there continues to be a persistent underfunding of federal programs serving Native communities that continue to exacerbate health inequities. In addition, COVID-19 has been exacerbating these health and mental health inequities and poses a threat to the mental health, emotional health, and spiritual health of all Native communities, and especially our elders, who are our keepers of essential knowledge and languages. COVID-19 has had a devastating impact on many Native communities. Infection rates, hospitalization rates, and mortality rates due to COVID-19 have disproportionately impacted Native communities. There are also some unique factors that it's important to keep in mind when discussing COVID-19's impact. Some communities may have collective memories of infectious diseases devastating tribes over the last 500 plus years. Some of these diseases were intentionally spread as a form of warfare and genocide. There are also structural inequities. For example, some communities may have little to no access to running water. If you think about CDC's guidelines of washing your hands to prevent the spread of COVID-19, and that's not possible because you don't have running water at home, you can't follow those guidelines, and it puts some communities at higher risk for COVID-19 infection. In addition, the threat of losing our elders is heartbreaking for Native communities. Our elders are our cultural keepers. And finally, COVID-19 has impacted our ability to participate in traditional community grieving practices and other ceremonies that we really think are important and are vital during this time. As you can imagine, all of the factors that I just talked about can also impact mental health, emotional health, and spiritual health. And early in the pandemic, in April to May 2020, Statistics Canada conducted a survey with 1,400 First Nations, Métis, and Inuit peoples in Canada, ages 15 years and older. And this online survey asked specifically about their mental health during COVID-19 at the beginning of the pandemic. What they found was that 6 in 10 Indigenous participants reported their mental health was somewhat worse or much worse since physical distancing was introduced in Canada. In addition, community loss can impact health and well-being in a number of ways. A recent analysis by APM Research Lab provided heartbreaking data that COVID-19 mortality rates were much higher in Indigenous communities in the United States compared to all other groups. Though COVID-19 has caused devastating losses among many communities, we're also now seeing Native communities lead the way in vaccine distribution. This graph depicts recent CDC data showing the percentage of people fully vaccinated by race and ethnicity. And what you can see from that yellow line at the top is that American Indians and Alaska Natives have the highest vaccination rate compared to all other groups in the US right now. This is largely due to tribal sovereignty, collective will and responsibility to protect our communities, and cultural values about the importance of our interconnectedness to our ancestors, our current generation, as well as future generations to come. As you can see from the previous slide, Indigenous communities have so much to teach the world about public health. Indigenous peoples and communities demonstrate their intergenerational strengths in so many ways. Indigenous knowledges connect and sustain instructions for health, wellness, and living a good life. Everyone can learn from this strengths-based approach to public health during the pandemic and beyond. This quote comes from an article written by a number of Indigenous scholars. And in this paper, they wrote, Indigenous ways of knowing not only imagine a more healthful world for Native people, but for all of humanity. Imagine if all people place their value and actions on the community and the environment over the individual, not just during the COVID-19 response, but in their daily lives moving forward. Indigenous knowledges include many things like memories, teachings, songs, and stories. And storytelling in particular is a really important tradition to a number of tribes, as well as Indigenous communities globally. Storytelling functions as a tool to heal from and protect against historical trauma and ongoing challenges that Indigenous communities experience. Storytelling has even been called medicine. And the importance of storytelling and taking an Indigenous strengths-based approach to public health has informed the development of a project that is very near and dear to our hearts, titled Our Smallest Warriors, Our Strongest Medicine, Overcoming COVID-19. And I'm going to turn it over to Emily to share about this amazing project.
Thanks so much, Victoria. So with all that in mind, we wanted to share a little bit about how we saw a need in the communities we work with and are a part of, and how we leverage this powerful storytelling tool to help equip families and children with public health information and messages of resilience during the height of the pandemic. So this began back in March of 2020. And at that time, we became aware of a book called My Hero Is You, which was a children's storybook about how kids can fight COVID-19. This was produced by the Interagency Standing Committee Reference Group on Mental Health and Psychosocial Support in Emergency Settings, and was developed with input from more than 100 countries. As we saw this book, we were also hearing our community partners say they were hearing about struggles with mental health, especially from isolation with others. This was right at the time that lockdowns were imposed, and many were being told to stay home and that their lives were being disrupted. We saw this book and thought, what if we culturally adapt this story for Indigenous communities? And so we consulted a few of our community partners and received positive feedback that this might be a helpful resource. And we also thought that this could help with flipping the narrative at the time, which was that tribes were helpless against the virus, to one of strength in showing how communities and children can now actually help fight and empower them to fight this pandemic. So I wanted to just briefly show you this video of the My Hero Is You book, so you can get some sense of what the original book was about.
All around the world, children's lives have been turned upside down. From lockdowns and uncertainties to watching loved ones get sick, normal life as they know it has come to a halt. While nations and organizations do their best to react to the COVID-19 pandemic, young people often feel alone, where their fears and anxieties start to grow and overwhelm them. But from this darkness, something incredible happened. A story of hope. It's a story that's based on the feedback of 1,700 children, parents, caregivers and teachers from more than 100 countries. They shared how they were coping with the COVID-19 pandemic, and from this wealth of heartfelt testimonies, a very special book was created. My Hero Is You. The IASC Reference Group on Mental Health and Psychosocial Support in Emergency Settings is co-chaired by the World Health Organization and the International Federation of Red Cross and Red Crescent Societies, and consists of 57 organizations. With the help of Ario, a fantasy creature, children from around the world have learnt how they can be heroes in their own stories.
Dati ka-helpen and ik was her andere mensen.
And what started as one storybook for children has quickly grown into a success story of global reach. Initially launched with 6 translations, there are now 126 translations available, making it one of the most translated stories in history. Numerous other adaptations have been created to make the book more accessible for children worldwide. An organization in Zimbabwe produced an English Braille transcript.
Wash your hands under running water. Sanitize your hands.
There is a 3-part audio version of My Hero Is You in Arabic, broadcasting on a radio station in Gaza. Across the internet, you can find readings, animations, podcasts, educational materials, and other renditions of the story. And not only that, other creative expressions have been made with My Hero Is You as their inspiration.
Jump on, but please sit on both sides of my wings. They're at least 1 meter apart.
Whoosh! A retelling of the story for Native Americans was created that represents Indigenous peoples, values, and communities.
I miss my friends, but I know we will dance again.
An imaginative adaptation of the story was made into a short animated film to convey messages of hope, resilience, solidarity, and empowerment. My Hero Is You has been a great resource to address the mental health and psychosocial well-being of children around the world in the midst of a global pandemic. People young and old need a story of hope and solidarity, a story that reminds them they are not alone, and they too can be heroes. To download the My Hero Is You storybook in your own language and preferred format, please visit the IASC website. Coming soon is Action for Heroes, a guide for adults for heart-to-heart chats with children reading My Hero Is You.
So with that, you could see that the book that I'm about to discuss, it was featured in this video, but it gives you a sense of sort of the scope of this original book. And then I'll talk a little bit about the detail about how we went through and created our version. So in early April, our team rapidly convened a collaborative team, and this the ability of 14 child development, mental health, and health communication experts. They represented 12 tribes on and off reservation, urban Indigenous communities, and non-Indigenous allies. And this was really facilitated by our long-term relationships and partnerships, and a real commitment by many to meet as fast and rapidly as possible in order to get this information to families as quickly as possible. We're also really privileged and honored to work with a youth artist, Joelle Joyner, who did the incredible illustrations for us. And then part of this effort, we consulted with our center's infectious disease experts. So as Victoria mentioned, our center has an infectious disease research arm, and we were lucky enough to be able to consult with them and make sure that any information we provided in this book was consistent with ongoing guidelines as they changed. The team provided professional expertise and personal experience as well. Many of these team members are also parents and grandparents, so they were able to use our drafts and discuss with their children and get their children and grandchildren involved in the creation process as well. So the adaptation process happened very quickly. We had 3 virtual meetings where we discussed and reached consensus on story themes, character development, and the major adaptations to the original storybook. We then met and provided feedback on different drafts, and finally conducted a final story text and illustrations. All of this was done virtually, and it also continued to develop some parent resources and children activities to accompany the book. So they're coloring pages, as well as other worksheets that kids can download. And then finally, the group met and reviewed the final content before sending to print. And this was complete. This whole process completed across 5 weeks. The focus on the themes in the book. So we need to focus both on public health information. So we needed this to be consistent information with public health guidance at the time. Wash hands, wear masks, watch distance were all the themes, and staying home due to the stay-at-home advisories. We also really focused on strength and self-efficacy. So we focused on a strengths-based approach, which go beyond traditional resilience to really focus on intergenerational strengths. So here we'd like to think about it's not just an individual ability to overcome adversity, but a collective experience that makes a group of people stronger. We also focused on self-efficacy. So this is a sense of control over one's environment and optimistic view of being able to alter challenging an environment or circumstance. And this again was a key message in here. We wanted kids to get a sense of empowerment and self-efficacy, so they could take control over their situation and have something to do and feel empowered in the situations they were in. And then finally, we focused on mental health coping mechanisms and acknowledging grief. So we included relaxation and behavioral activation approaches, which are evidence-based approaches from psychotherapy that address anxiety and depression symptoms. And then we also really, following sort of the latest knowledge on how to address grief, was acknowledging it and talking about it in order so that we can inform kids and let kids know that grief is happening, so that they can ask questions and and understand it. So ultimately, we created 35 pages of text, and the themes were, the main characters are youth twins named Tara and Virgil. The twins' mother is a nurse, and the father is a tribal leader. And there's a grandmother in the book representing the intergenerational homes that many people in the communities live in. We wove together this public health guidance, mental health, and coping strategies throughout the story. And we created 9 parent resources, materials, and children's activities. And you can see here on the right is an example of the illustration with the grandmother sewing masks, the children playing, and the mother coming home from working in the hospital and actually taking off her hospital clothes and putting them in the dirty clothes before entering. Here's another example of how we wove together these themes. So this is an example of the kids sitting after eating their dessert, which was fruit, while their mother ate her dinner late at night. So Tara says, "This makes me feel sad and afraid. How can we stop if we can't see it?" Tara asks. And the mother says, "Let me give you a hug, little ones. One way we can help stop it is by staying home. This virus affects everyone. Children are special medicine, and you can both help heal our communities by staying safe." So again, the message here is acknowledging that these feelings are there, but then also giving children empowerment that they can control some of their environment and deal with these feelings going forward. So another urgent need was to get this book out as quickly as possible. And so we developed several tools for our dissemination strategy. First, we rapidly understood that internet access, due to ongoing sort of infrastructural challenges and underfunding, is limited in many reservation and rural communities. And so we needed to print the book. We also wanted to have this available to individuals that have internet access, so we created an online version as well. So all of the materials are stored on our webpage, and they're free and accessible to use. We also created a social media campaign that promoted the book on social media. And then we did some print copy distribution, so in several ways. So our center has a evidence-based home visiting program, Family Spirit, which is one of 20 evidence-based home visiting programs nationwide. And this program serves over 140 communities. And so, and this is for early childhood home visiting. And so we contacted all of our Family Spirit affiliates and they requested the number of books they wanted. And then we sent them to those to distribute through to their clients. Johns Hopkins Center for American Indian Health also has an MOU with Indian Health Service. And so this was activated during the pandemic. And we were able to leverage that relationship to distribute books to pediatric clinics through IHS networks. We then also worked with our ongoing research and programmatic partners, the White Mountain Apache Tribe, Navajo Nation, and 11 Ojibwe bands, to distribute books through our sites. And this was often done in the form of wellness boxes. So our center team members and other community members were putting together wellness boxes to distribute to individuals in the community who were in isolation or quarantine. And these wellness boxes included traditional medicine, traditional herbs and tea, as well as some other informational materials, some masks, and then we included the books as well. And then we included a first come, first serve online request form for any individual who wanted to request the bulk order of these through our center for free. So in addition to the dissemination, we wanted to understand the reach and impact of the book. Doing an evaluation study in the context of an active pandemic is extremely challenging, and we had to balance rigorousness in our evaluation with need to distribute this book as quickly and fastly as possible. So we tracked the distribution of books to families with children, and then we included a voluntary anonymous caregiver survey. The survey QR code was included in the book as well as linked on our webpage. So in terms of dissemination, in total, we disseminated over 42,000 books. This reached 12 out of 12, all 12 Indian Health Service regions across 27 states. That included 105 tribes, reached 12 First Nations communities, 56 intertribal and urban organizations, 112 tribal health departments, including 42 Indian Health Service clinics that are partnered with those health departments, 44 Family Spirit affiliate programs, 20 Head Start programs, 3 libraries, and 8 schools and educational-based organizations. Some highlights from our caregiver survey responses. So caregivers discussed challenges and understanding of the COVID-19 pandemic. Caregivers expressed that the book helped their children to understand some of the reasons for COVID-19 precautions. It also gave children ways to express their own emotions. Respondents noted that the storybook was an important catalyst for children to recognize and express their own emotions. And then critical to all was representation of contemporary Native peoples. Caregivers really underlined the importance of representing Native children in storybooks and seeing children like themselves depicted in books in ways that felt accurate and contemporary. And I would also say that this is really important, not just for Native families, but for all families to see Native people in contemporary ways that represent sort of who Native people are today. So with that, our team has been rapidly working on a sequel to this book. The sequel will focus on new challenges and public health strategies for Native children and families. So these might include adjustments to education. So some schools in Native communities are still closed, some are reopening, and that's changing all the time. But without a doubt, this year has been the most disruptive year to education for many children and families. And so thinking about acknowledging that and putting words to that and letting children and providing discussion points around that for families is really critical. We'll also focus a lot on modifications to birthday, holidays, and cultural celebrations and gatherings. And then, as Victoria noted, the vaccine distribution is incredible, and it's so exciting and amazing to watch how many vaccines are being distributed in these communities. And so this book will also focus on that, particularly as vaccines become more available to youth and children. And then it will continue to focus on ongoing strategies to reduce risk of transmission as well. So we will be sharing that book as soon as it's coming out. It should be in the next couple of weeks, which we're very excited about. In addition, we just wanted to wrap up with some words from some of our youngest team members. So this book was featured on the World Mental Health Organization's World Mental Health Day. And you saw a clip of this video previously, but I'd like to just share the actual whole thing to hear from people, from Hoyani, who's the child herself, on what this meant for her.
Yat e she'e Hoyani ki nyinye
Yat e she'e ya crystal ki inshye. And we join you today, my daughter and I, from Dinetka, from the Navajo Nation. And a few months ago, we were given the privilege of being able to work on a project with other colleagues from Johns Hopkins Center for American Indian Health to adapt a book about COVID-19 and the impacts on our children across Turtle Island. So to help me tell this story and the impact of this book, I've invited my daughter Hoyani to share her thoughts. So Hoyani, how has the book about COVID helped you?
To learn how to not be worried, and to learn that we were being safe.
Yeah. Worry sat right here in our hearts, and it sat right here in our minds. And not only for the people that were adults like me, but for children like you. And so the book was to really share how people can do certain things to be able to stay safe and to be able to protect one another and to be able to learn how to continue to stay connected and to have hope. So, how have you been a good relative?
I love my relatives, and we try to stay away from them because we don't want to be around people because this corona, and we want to be this safe.
Yes. So social distancing, wearing our masks, and being able to just remind each other that this is the way, by staying away from one another, is the way that we show our love. It is the way that we say we respect you and we want to be able to see you again soon.
I miss my friends, but I know we will dance again.
Yes. So you will dance again. You and your friends. You will stomp on the earth, on our mother, and we will hear you guys again as you guys all laugh and rejoice and play and grow.
So with that, I wanted to just really express our deepest gratitude to the wide range of people that supported this project in all its facets. And so we have a whole team at the Center for American Indian Health, our colleagues who helped with the adaptation process, our colleagues at Indian Health Service, our funders, the Johns Hopkins Alliance for a Healthier World and the Johns Hopkins University Office of the President and Provost, who provided the initial seed funding to get this up and running, UNICEF USA, Casey Family Programs, who have continued to fund this, and the sequel coming forward. And just really, the storybook is dedicated in loving memory to all our relatives whose lives have been impacted by COVID-19 and all the frontline workers whose relentless efforts have saved so many. So with that, we'd like to open it up to questions or comments as well.
I saw one question or comment about the link. So we shared the link to our original book. And as we mentioned, the sequel will be available very soon. We're so excited. So keep an eye on our website as well as our social media platforms through the Center for American Indian Health. We're on Twitter, Facebook, and Instagram, and we'll be releasing all of that information very soon. Looks like we have a question, and the question is, what is the level of vaccine hesitancy in the communities with which you work? Emily, do you know about that?
Well, I was going to say that there is clearly some hesitancy at times from some people, but you can see by the vaccination rates that overall it's perhaps less than in other places. And part of the reason that may be, in addition to the things Victoria pointed out of sort of a collective responsibility to take care of our shared responsibility in our community. In addition, some of the vaccines actually were done in partnership with tribal communities and involved a strong community-based participatory process. So some of the original trials, in particular the Pfizer vaccine trial, And this process involved, I think it was something like over 40 community meetings before the site even launched. And so you can just imagine that building that trust over time from the very beginning in these vaccine trials and in public health interventions in general is so critical when working with communities that normally, that face health disparities. So really working sort of over time to build trust and making sure they're included and their voices are heard in these processes does a lot to actually impact public health more broadly.
And I can add that there was a survey in January 2021 that was conducted by the Urban Indian Health Institute, and they did a broad survey of American Indians and Alaska Natives asking various questions about the vaccine and whether they were planning to get the vaccine. And among that survey, they found that 75% of respondents said they would get the vaccine. And one of the major reasons that individuals said they wanted to get the vaccine was the community sense of responsibility to protect everyone in the community. So that goes back to what Emily was saying about really focusing on protecting the community.
There's another question that reads, has access to telemedicine had an impact on the health of tribal communities? Victoria, do you want to start?
I can start. As I mentioned earlier, every single tribe is different. Their access to healthcare differs widely based on location. Some tribes are located in reservation or very rural areas. Others are in urban areas, and healthcare access varies widely. So within reservation and very rural communities, there may be some barriers to telehealth or telemedicine. So that is definitely something that is being worked on nationally in terms of health policy and increasing access to broadband for tribes or communities that are located in very reservation or rural areas where that might be a barrier. It looks like someone's asking, have you considered creating books that address public health issues that impact Native communities beyond COVID-19? That's a great question. I can start, and Emily, if you have anything to add, feel free. This is something we have thought about because we saw such a high demand and satisfaction with this book. We would love to think about future books that could address a number of public health or mental health promotion strategies and information for Indigenous children and families. This could be related to mental health coping. We've talked about nutrition topics. Really, there's so many possibilities, and it's definitely something that's on our minds. Great question. I think that was the last question. So we will end here and say thank you so much for everyone who attended, and thank you so much to Hopkins at Home for having us today.
Thanks so much. Have a good day, everyone.